Okay. This is my 7-week post-op update. It's been a long time since I posted a video, for good reason. I'm one of the ones who had complications with my surgery. My surgery was on December 14th, and pretty soon afterwards I was able to get up and walk. Like 6 hours later, I was walking fine, felt good, you know. But then when it came time to eat or drink anything, even my own spit, I was vomiting heavily. Like even on my own spit, like the other patients around me, it was at a bariatric clinic. They were doing fine. They were walking. The next day they were eating popsicles, and I still couldn't take anything down. So right away they thought it was swelling. So I stayed for a few days past. The other people were discharged 2 days later, and I was still there. I was the only patient that left over because everybody else was doing good and they were going home. So then we figured out soon enough that it was a leak, I believe, or it was too tight, or. So I went back and had my second surgery. They went through the same hose, same laparoscopic hose, and they loosened it up some and made sure there were no leaks. And after that surgery, I was wore out. I did not do good coming back from anesthesia from the first or second surgery. So I just do not do good with anesthesia, because both times coming back out of it, it was rough going. So then I was in the clinic for 7 days, a whole week. I was the only patient for most of the time until the next surgery day came around. So I was discharged home. Again, like, he wanted me to stay longer. My surgeon wanted me to stay longer, but I was ready to go home. I was there for a whole week, you know. So I went home. And that same, thought I was feeling better. I was keeping my everything up. Because at that point I couldn't eat a popsicle. I could hardly drink any water. But that day I was able to drink some water, so I thought I was better. So he let me go home. So within 24 hours, I was back at the ER at a hospital, because I felt like I couldn't breathe. So the squad was called, and I went to a hospital. I told them I recently had surgery, so they did a CT scan to see what was the issues, and then, you know, did the regular normal doctor stuff. They said they had fluid on my lungs. So they sent me back to the clinic, and I was there for more days. You know, they were treating me, seeing what, you know, just observing me and whatever. And then I got worse. My became tachycardia in there. Like, that just means my heart rate was off the rockers. At one point, it was got up to 182, but it was, they had the fan on me. I didn't have a fever because my temperature was reading normal. Well, not normal, but my temperature was only 99, you know, but so that was it. But I was sweating, and I was tachycardia, so that's why they sent me to the, plus the fluid on my lungs, but they still wasn't for sure. But then I was sent out to a different hospital. So this is my third hospital. This is my surgeon's home hospital, because like I said, the surgery was at a clinic, so I went to his home hospital in another city. That was a half hour from where I'm from. Even though my city it was a small town he sent me to, whatever. Bad hospital experience, horrible. The staff there, it was just not the town I went to is, I think me and my family were the only black people we saw. But it wasn't that. It was just a horrible experience at the hospital. Ended up having it was just horrible. But I went there, and that's why I had my third surgery at my surgeon. He put a chest cavity in because I had pneumonia and I had an infection in my stomach. Now, mind you, I don't remember this. I was told all this by my family because, like I said, I don't do good with anesthesia. After I came out of anesthesia, I was on the ventilator for 2 days. So I don't remember being in ICU at all. I just remember the ambulance take me from the clinic to that hospital, and them told me I was going to have surgery again, and crying. Next thing I know, she put the IV in my arm, and then I remember going down to the pre-op surgical room, them trying to get me to urine just to make sure I wasn't pregnant. I was like, after taking 100 pregnancy tests, you know. And went to surgery, and I don't remember being in ICU at all. I thought I was out. When I woke up, I thought it was the next day. I found out 3 days had passed. So I had surgery on, I believe, the 23rd or the 24th, and I don't remember anything till the 27th. And I didn't realize I was out of it for that long. Even when I had come up out of all the ventilation system, was able to talk, I still didn't, my heater is about to get loud, I still didn't remember anything until days later. So I was in a ventilator during Christmas. I was out of it. So basically I was in the, and so the pneumonia, I guess, subsided. I was, went away, and the stomach infection went away. They were treating me with antibiotics and everything. Horrible hospital experience at this place. I was there from the 24th through the 31st when I was finally discharged home. So basically I was in the hospital from December 14th through December 14th early morning through December 31st in the afternoon. I was finally discharged, and I was still, my doctor still didn't want me to go, but I basically complied to him that I was going to leave whether or not he wanted me to, because it was such a bad hospital experience with some of the staff. Like I had some staff members were really good. Not everybody was bad, but some staff members are really, it was not a good experience at all. It was horrible. And patient services were called, and I just couldn't believe it wasn't good. So I knew I was going to leave that day anyway. I couldn't stay another weekend there. So he discharged me, and I went home. Also, I went home with the feeding tube, because I had a feeding tube implemented last time I was in surgery, the cap tube there, because I hadn't eaten in so long. So I had a feeding tube, so I was discharged home with the feeding tube, and two of my two output tubes, 2 drainage tubes still I was discharged home with. Yeah, so I was went home with the feeding tube hooked up to a heat feeding tube, but I had to push it around, the feeding tube, and these 2 JP drains that were still attached, because he wanted to make for sure that they're triple check. And then I was triple checked in the hospital to make sure everything was fine, a bunch of scans and tests and x-rays, stomach stuff, and there was no leak, and I was fine. So I was discharged home on the 31st. I was doing okay. And just as I was starting to get better, like, because mind you, like, my walking is still not even close to where it was, because my walking is very slow. It was even worse. I was a fall risk the whole time I was in the hospital. Could barely walk. Even when I came home, my walking was not good at all. I didn't know about that. Nobody told me how. I don't know. Well, I guess I don't have the usual weight loss surgery story, because one surgery ended up turning to 3 surgeries. So I had 3 surgeries in less than 2 weeks. So yeah, so my walking is still not where it should be. Not where before, not normal. When I walk out in public, I try to speed up because I'm out in public, but I'm still very slow going. Let me see where I'm at. Okay, yeah, what else? So I came home on the 31st and starting to get better, you know, and then all of a sudden I had difficulty breathing. I was walking and stuff every day, you know, walking feeling good, thinking I'm on the mend, you know, difficulty breathing every time I walk, and then simple tasks that I had no problems with, just talking, I couldn't breathe. So I called a SWAT again, went back to that time we drove to the ED, and then I was telling my heart, I couldn't breathe, my heart was hurting, you know, and then they ran all these tests, and the last blood draw, and the last in the CT scan they did, it finally results showed that I had blood clots in my lungs. I was like, oh Lord. So they started me on more blood thinners, because I was already getting a shot in my stomach every day while I was in the hospital. So they started me on heparin through IV. The shots started back up, and finally I was released with Coumadin 3 days later. And then I went home, and then the next weekend a squad was called because this time it was even worse on my right hand side. Every time I breathed in and out, it was hurting. So, I was taking shots and taking my blood thinner, and I Coumadin regularly. Still had a situation come up, so this time a squad was called. It took me to this is the 5th hospital. The hospital in Columbus I actually like, so I didn't have any problems with the hospital here. It was just the one hospital where I had my 3rd surgery at that was in another state that I had issues with. But anyways, I was discharged to the 5th hospital because it was closer to the house, and the squad wanted to take me to the closest hospital because I was having breathing difficulties. So I went there, and then they think possibly a blood clot grew, and somehow some more had popped up. So I was released from there 3 days later again. Now, mind you, by this time it's the 18th of January. So, yeah, so that's been my journey so far. And now today is February 5th. Today is the 8th. It's the 2nd week of February, the Tuesday. But yes, that's been my journey. I can't exercise because I still can't. Doing simple tasks still make me lose my breath. I developed a cough, so I'm going to ask my PCP about that this Thursday. I go see her every week for a blood test, and she sees what's going on with me physically. Cut my hair all off because I could not deal with it while I was going through all this. I just wanted to heal, and I didn't want to be worried about my hair. So yeah, that's been my journey so far. I still have issues eating certain foods, like the amount of foods I'm on regular foods. The amount of foods I should be eating, I can't. They say, I can't consume. I still have. Lately, vomiting has become an issue again. So I'm taking anti-nausea medicine. So I still have difficulty breathing. I just want to put my story out here because everybody else's story there, and I'm glad for them. I'm happy for everybody whose surgery went according to routine and everything is going good. I'm happy for you, but mine is not. So my story is, just wanted to put my journey out here that for those who don't go according to plan, it is getting better. It's getting a lot better, but it's still difficult journey, a hard journey. And right now, do I regret it is the thing I'm dealing with now. My sister says you shouldn't regret it because look at all those years you dieted. And I think once I get far enough out distance from this, once I stop taking the blood thinner 6 months out in July, was when they want me to stop in June, beginning of July when they want me to stop. Maybe then I'll have a perspective like, oh, it was worth it. But right now, I'm just not feeling that right now. I just wish I never had anything done. It's like I was healthier, a lot healthier before surgery than I am right now. And I know it'll get better, but being on this end, still going through it every day, it just doesn't feel like it was worth it. But yeah, so that's where I've been. But I'm going to start making weekly updates, and hopefully by my 2-month post-op next week, I'll be in a much better space. I'll be doing a lot better than I am this week. Peace out.